All right, hello everybody and welcome. First, I'll just introduce myself if you haven't seen me yet. My name is Adam Dedmon. I'm the new Employee Benefits Manager here at Aqua JPIA, and I am very fortunate to work with the fabulous team here. That team is on this meeting with us, and they are ready to answer questions in the chat if a question comes up in the chat. We are being a little bit intentional and trying not to get too far down into the details. That, I think you all understand that you could ask a pretty detailed question that could take a long time to answer. So the team will do their best to answer any questions that show up in the chat, but I'm going to try to keep this presentation in an elevation, mostly for reminders and things that are changing. And obviously, if you have questions after this presentation, you can reach out directly to us at the team or to me directly, and we'll get back to you. Okay. Here's an overview of what we're going to talk about. We'll just mention the rates, standard and incentive as well. There are a few changes and enhancements. We'll talk about CDHP deductible changes. I have a couple things to say about Carillon, which is our pharmacy benefit manager for our Anthem plans, Delta PPO enhancements, and then some reminders with our point solutions with dental. A reminder about life and disability, and then open enrollment, and then some Q&A. Okay, this is an overview of our rate increases from last year. These have all been approved by our executive committee with the exception of the UHC Medicare Advantage PPO rate. At this point, we believe that approval is a formality, but I do want to be clear and say that that has not been formally approved. It's a 25% rate increase, which actually works out to 24.2% on year end once we factor in administrative fees and things like that. The rest of these rates are confirmed and approved. Okay, and we might be talking to people who've been doing this for 10 years, or maybe this is their first one, so we like to go over these reminders. For standard requirements for standard rate, employees must work at least 20 hours per week unless they are a director. No greater than 25% of benefits eligible staff may waive coverage. And employer contributions for premiums must be at least 100% of the least cost plan for an employee, and it must be the same for directors. So that's the basic requirement for you to be with the Aqua JPIA. In addition to the standard requirements, we offer a 4% incentive rate. And to get that, all eligible employees must enroll with contributions for dependents, being at least 50% of their premium. And also the district cannot offer cash in lieu. There are lots of details with the standard and incentive rates. And this webinar and the PDF for this presentation that I'm showing you is going to be linked in our employee resources page, and all of these links are active. So you can get into that document and you can click on participation requirements or or retirement policy requirements. And you'll see there are lots of other links in the slideshow as well. Okay, there were some changes to CDHP deductible. The IRS max contribution increased to $4,300 for single, $8,550 for family, and a reminder that at age 55, the IRS does allow a $1,000 catch-up contribution. Anthem and Kaiser CDHP deductibles are increasing effective January 1, 2025. That'll be $1,650 for single coverage and $3,300 for family coverage. There are no changes to the out-of-pocket maxes for Anthem CDHP. And there are some changes with the Kaiser CDHP. The out-of-pocket max for single coverage will increase to $3,300, and the family out-of-pocket max will increase to $5,800. Yeah, I know I threw a lot of numbers at you there. A quick update on Carillon, which I'm sure you're very aware of. Our Anthem Classic PPO, Advantage PPO, and CDHP prescription drug benefits are managed by Carillon RX, which is from Anthem. The mail order requirement for maintenance medications was lifted by our staff on March 25th of this year, and we lifted it through December 31st, through the end of the year. We spent a lot of time with Carolyn working through the issues. The main issues were customer service, response time, and home delivery concerns. So we are going to turn the requirement for designated pharmacies for maintenance medication back on effective January 1. That does not mean you have to do home delivery, but that's one of the options. So the users can switch to Carolyn home delivery, or they'll have to use Albertsons, Vons, Pavilions, Ralph's, Costco, Walmart, Sam's Club, or Safeway. Reminder that maintenance meds are 2 times the retail copay for a 90-day supply. And this is really important to mention, so I really want to underscore this. If anyone is using a pharmacy that's not listed above, because we turned off the requirement in March, they will get a letter from Carolyn in December and in January that reminds them that they need to go back to one of these options. So if they're getting their prescription for maintenance, if, for example, Rayleigh's or something, they will get a letter that reminds them they need to go back to Carolyn home delivery or to one of the pharmacies listed here. In order for a prescription drug to be considered maintenance, 2 30-day prescriptions must be filled before it's considered maintenance. Okay, the chat is nice and quiet. I think that's good news. For our Medicare Advantage plans, your members on KIPSA, Kaiser Permanente Senior, or UHC, they are going to see some changes to their coverages, and it's too detailed to outline all of that here, but I just wanted to mention the 2 main factors for the rate increases that we saw this year and the coverages that will change. The Centers for Medicare Services, or CMS, changed their reimbursement rates, which means those companies are getting less money back than they probably expected for providing the Senior Advantage plan. And the Inflation Reduction Act from 2022 has impacted the liability on the plan. So with drug costs and with care. So more of the costs for these plans are being are on the plan themselves. So the providers are passing those costs along to the members. Okay, some good news. We enhanced our Delta Dental PPO plans this year. So all PPO plans with Delta will get a users can get a third cleaning during the calendar year at 0 cost in network. So they can add that third cleaning. And also there is now a diagnostic and preventative care max waiver. So a participant can receive diagnostic and preventive services without that cost applying to the benefit amounts. So that's another really nice piece that we added to the PPO dental plans without a rate increase. Okay, some reminders with dental and vision requirements. Dental non-voluntary rates, all eligible employees and dependents must be enrolled. For dental voluntary rates, all eligible employees must be enrolled. Dependents may waive the coverage. For vision composite rates, all eligible employees must be enrolled. Dependents receive free coverage, so they should be enrolled. And vision tiered rates, all eligible employees must be enrolled. Dependents may waive coverage. Okay, some reminders for our point solutions. If you are on, for members who are on Anthem PPO or CDHP, they have access to Progeny, which is a fertility and family building benefit. They have access to Hinge, which is digital physical therapy. They have access to Carum Health, concierge orthopedic and weight loss surgery. And they also have access to Carum Oncology, which is guidance and assistance and second opinions with cancer diagnoses. This year, we added WellHub as a fitness and wellness benefit. And again, that's only for the Anthem participants. For Anthem and Kaiser participants, the JPIA provides Modern Health, which is virtual mental wellness and therapy. on this slide here are links to the latest versions of their flyers and their overview documents. So if you'd like to learn more about those point solutions, just be sure to open up that PDF under our employee resources page, and you can find out more. Okay, while I have you, I just wanted to give everybody a reminder that the Aqua JPIA also has available life and accidental death and dismemberment insurance through the standard. And we also have an employee assistance program, or an EAP, through Anthem. If you're interested, just reach out to our staff. At this point, it is too late to get those added for January 1, but mid-year implementation is possible with these. Just reach out to the staff and we can work with you. Okay, open enrollment, as you know, begins October 1, and our window that we provide to you is October 1 through November 8. We recommend 2 weeks because we find that we get the best engagement if we set a window of 2 weeks. Make sure you take a look at the open enrollment to-do list, which was in the email communication we sent out. It's also linked in the renewal packet, and all of those things can be found on our employee resources page. Please don't forget to distribute required notices, and please don't forget about your retirees and those who might need COBRA. Inform employees this is their once per year chance to make changes outside of a qualifying. Okay, we want to remind you to make sure you are approving bSwift changes. We have admin user guides for you on that resources page as well. Was just talking with the staff this week about making sure those are updated and they are all ready to go. There's an open enrollment user guide that your staff can take advantage of. And this is not a requirement, but we did want to mention that agencies can generate batch confirmation forms, and you can get physical signatures from employees as a final confirmation of the benefits they've enrolled in. And we've seen districts have success with that because it's a final check, and then you catch any last minute confusion or errors with that. I want to be clear, this is not required by the JPIA, but it is available in bSwift. And in the admin user guide, there are resources to help you see how to generate those batch confirmation forms if you'd like to add that extra check and that extra layer of documentation to their enrollment. Okay, so this page has some important links, and these are all linked to the employee resources page. There's the login and the password if you need to get into the employee resources page. We like to control this so that only our members are getting in there and seeing all these documents we've created. Most important on here is the open enrollment to-do list. So make sure your team is using that as they gear up for open enrollment. And then there are refresher videos on some of the point solutions, which are linked down there as well. Feel free to share those with your members if they're making decisions about those point solutions. Okay, I feel like that was extremely fast. Nobody sent me a panicking chat message or a Teams message or anything during that. If there are any questions that might be good for the order, I think typing those into the chat right now would be good. If you have a detailed or individual question, again, please use this email address here or reach out to any of the team members that you have communication with already established, and we will be happy to help you out. I'm just kind of keeping an eye on the chat here. I don't see anything popping up.
There are a couple questions that are popping up. So I don't know if you can see them, Adam. You may not be able to from your perspective where you
I see them now. I had to scroll down.
Okay. So from Stephanie, yes, Stephanie, it's going to be on the employer resources page once the webinar is over. I think it actually might already be posted, right, Adam?
Yeah, so the PDF is posted, and then once we complete this recording, I'll send that over to Sonia, and she's going to throw that on the resources page today, so shouldn't take very long.
Okay, and then I think this is Bridget asking about, will we get a copy of the Carillon letter when it goes to employees? we will not get copies of the actual letter that is directed to the employee, like with their name on it. We will have a draft that will be a final draft that is basically the template of what will be going out. So we can definitely provide that if that's something that you want. So I'll reach out to you directly on that one. Okay, Bridget. And then diagnostic preventive waiver process for the dental. What that means is there's really nothing that you need to do, or the employee needs to do, the patient needs to do. If they have diagnostic preventive care, an exam, an x-ray, a cleaning, then the costs associated with that the plan bears, they will not be taken away from the employee's benefit maximum. So they get the care that they need, but it doesn't reduce the amount of money available to them on an annual basis for dental. So hopefully that answers that question. Ed has
there's a question on the UHC rates, and I can take that one while you read, Jackie. So September 26th, our executive committee is meeting, and that's when we expect them to formally approve those rates. We are not offering alternative rate increases or anything like that. The rate is what it is. So at this point, it's, it's just out. It's really a formality at this point, but it will be official on September 26th.
Perfect. The next one I'm going to let Ben respond to, because I think I know the answer, but I'll let him say it, which is about employee does not need to make any changes. They don't need to do anything.
Okay, yeah, you're correct. All benefits in B-Swift will automatically roll over. If you do have employees with HSAs, you do need to collect new contribution amounts, and we do have HSA enrollment forms. Those are only required for individuals electing a CDHP plan for the first time and enrolling in an HSA for the first time. But during open enrollment, you're welcome to use those forms to collect your payroll information to update payroll deductions for the new year for the HSAs. So that is outside of B-Swift. Other than the HSA, if you have FSAs, you would need to collect that information, and that would also be outside of B-Swift. So any JPIA benefits like life insurance, medical, dental, and vision will automatically roll over in our system. There's nothing that needs to be done to continue that coverage. It is nice to print those confirmation statements and have employees sign off on those confirmation statements, because sometimes employees meant to make a change and they forgot to go in and enter the change, and then come back in January or February and say, hey, I thought I entered this, I missed it, I made a mistake, can we make the change now? And unfortunately, we're going to look in the system to see if there was an attempted change, if there's any way we can support what was communicated. And if there's nothing showing that this person made some attempt to do the change in the appropriate open enrollment time period, we aren't going to allow the change. So it's very important to verify that everybody who wants to make a change has made the changes they intended to make.
Ben, I'll grab the next couple, and then Adam can read forward if there's one that he wants to handle. But the question about PDFs, the link is a PDF. So when you click on the link, it will take you to our employer resources page or our benefits webpage, depending on the document. That is where you will be. It will put you into the PDF. You can then file save as or download the PDF if you want the actual copy on your own site. And then the next one is about the maintenance prescriptions. No, they are not going to be automatically moved to mail order, because again, they have a choice. They don't have to do mail order. They could get those medications at one of those designated pharmacies that we listed. So Albertsons, Vaughn's Pavilion, Safeway, Costco, etc. So no, it's not an automatic thing. And if folks right now are getting those maintenance medications at Rite Aid or Walgreens or CVS or one of those big pharmacy chains, they will get that letter from Carillon in December and in January to remind them that they need to change that process. If they're going to have to transfer that prescription to either Carillon home delivery, if they want to do that, or to one of those other options. And then the next one, Adam, do you want to take that one?
So for those of you, a few people have made a note that they jumped on late. There'll be a recording of this webinar on the resources page, probably by the end of day today. And also the PDF of this slideshow, which should have all the active links, is already in there. So you can go there and find out more, and then the recording should be available.
And I want to respond to the chat from Denisha. The UHC plan guide and highlights, we just received those this week. So we have to remember that with any Medicare plan, we're sort of working on CMS and other regulatory agency timelines. We're not working on the same timeline that we do for actives. And so we just got that, I think yesterday. And so it's in review. We're making sure it's all accurate. And once we've done that, we will post that to our JPIA benefits webpage. Not on the resources page. It will be on the actual page where employees can access it and look it up. And that's where you guys can get it too. Edward's question, Adam, do you want to?
Yeah, I can kind of reiterate what we talked about. There were a lot of changes. The main driver of the rate increase is that the Centers for Medicare Services did not provide a very robust reimbursement rate for the providers. So therefore, the provider is reimbursed by CMS for every Medicare enrollee that they cover, and they're getting less money from the feds per enrollee. So therefore, that cost is getting passed along to the plan. It's worth noting that for the UHC plan, we're still in line with where our rates were before we switched to UHC in 2021. The premiums are pretty close to what they were in 2021 when I believe it was Anthem. We had that coverage through. So, you know, our feeling is that it's a catch-up year where rates are getting back up to where they probably should be, and we don't anticipate these huge rate increases in the future with UHC. But, you know, now we're getting into crystal ball territory. So that's the main driver. That and the Inflation Reduction Act are what went into that rate increase.
It says, where can we find the updated HSA forms? I believe if they're talking about the enrollment form, I believe that we have posted that on the employee benefits webpage under forms.
And that is only for employees enrolling in Aqua JPIA Health Equity HSA. If you have a HSA through us, then you would need that form, and that form is only required when somebody enrolls. So you don't have to enroll or don't have to upload the HSA forms for people who have already been enrolled for prior years, because all we need the form for is sign off on that legal text at the bottom that Health Equity requires us to collect in order to open an HSA account. Once we've collected a sign off on that legal information, then the form is pretty much used to verify that you aren't going to cause your participants tax problems by allowing them contributions to an HSA when they aren't eligible. And then it also allows you to request in writing what they want deducted from their paycheck. And if they want to make mid-year changes, you can also use this form to make mid-year changes to their HSA contributions, because they can change their contributions throughout the year as often as they like. So this form is more of a convenience. We do follow up for anybody who is new to a Health Equity HSA plan to request that form be on file to meet Health Equity's requirements of us.
Thanks.
I think we've
And-
touched all the questions, Jackie and Ben, would you agree? I don't see.
I don't see any new ones. I just answered Mina, and I want to say if anybody has any questions about open enrollment and making changes, like if their employees like want to change a medical plan or whatever, and you are new to B-Swift, you can always reach out to our team in Roseville, and they will help walk you through making those changes and approving those changes in B-Swift. And that's all I see.
Well, before we wrap it up, I just want to say thank you very much for joining, and we really encourage you to reach out to us with questions, because that's how we find out what's going on, is when people ask good questions. So please never hesitate to send an email, pick up the phone and reach out to us, because the sooner we know about a concern, the sooner we can jump in and help you and point you to the right resources. So thank you so much. Let's see.
I got one question here from Darcy.
Okay.
Should we still upload the HSA forms to B-Swift? This may be a Ben question. I believe yes. I do not see the updated HSA enrollment form. Darcy, I will double check it, and if it is not there, we will put it there, and I will let you know where it is, okay?
And in regarding to uploading the HSA form to B-Swift, we need it uploaded once to B-Swift. And once we have it once, you're welcome to continue to upload those forms each time they submit a new version for your records to see it in B-Swift, but we aren't going to require it after we have it signed off once.
I think that's it.
Okay. All right. Thank you, everybody. I think we're going to call an end to the webinar here, and then Sarah's going to help me get this recording saved, and we will get this on the resources page as quickly as we can.